Good thing number 2 that will never happen in American healthcare. Set an actual budget for spending. Boy, the United States spends about 18% of GDP on healthcare, which is way more than other nations spend. Nations that do a better job on, healthcare. So we could cut that back to, let's say, 14% of GDP, which is still a lot more than many nations, but it's doable. So here's what you would hear if the Americans cut back their healthcare spending to 14% of GDP and strove for the better outcomes that other countries achieve. You would hear, oh my God, oh my God, oh my God, oh my God, that's such a big reduction in healthcare spending. We're all going to die. That would come from the vertically integrated for-profit insurance screaming about death. And the death they are talking about, they don't mean you're going to die. They mean their executive bonuses are going to die. The horror. So this is obviously never going to happen, but a good thing would be for the United States to do an actual realistic, I know, funny, assessment of its American healthcare capabilities and the time and the resources spent on them. This assessment would discover that the U.S. healthcare system is a giant patchwork of insanity. Expensive insanity that should, in an ideal world, just go the fuck away, which would entail things like changing hospital spending in the U.S. because hospitals in the U.S. are outrageously expensive. How expensive? Like charging $1.50 for a Tylenol that costs 1.5 cents. So charging 10 times what the pill costs. But sometimes hospitals mark up their goods and services by up to 1,000%. So one big, fat, important way to drive down hospital costs in the U.S. is to get rid of the fragmentation of the American healthcare system, which means getting rid of all those for-profit insurance companies, government entities that get involved in running hospitals, and the never-ending expense of billing and collections, and driving Americans into bankruptcy and all the shit that goes with that. In fact, you would do better to just get rid of for-profit hospitals altogether. That would get private equity out of the picture, and if we get private equity out of the picture, we've saved a shit ton of money already. Not 4% of U.S. GDP yet, but a shit ton. And after hospitals become nonprofit, they can stop charging on a fee-for-service basis, which means they don't charge you by the Tylenol and for the big, expensive, unnecessary robotic surgery that they make most of their money on these days. So here's what you would hear if we started to do that. Oh my fucking God, you can't do that. Everyone is going to die. By which private equity and insurers and executives and for-profit hospitals mean their executive bonuses would die. They would say, oh, that's socialized medicine. How can idiots and assholes become supremely wealthy if you have cost-effective hospitals? Maybe they can't.